Good morning, everybody.
Good morning.
So nice to be here at the Southeast Seattle Senior Center. We love coming here. I was just admiring the flowers outside. It's such a great space, and not least of all of you make it really fun to be here. So thank you. My name is Dinah. I am the program manager for Age Friendly Seattle. That is a citywide initiative focused on really creating a city where all of us can age with joy and with dignity. We host these monthly events in partnership with our friends at the Seattle Public Library. Emily from the Seattle Public Library has a few announcements, so I will hand it over to her. I want to turn it over to our panelists in just a minute, but first I want to sort of ground us in why we're here. So today's topic is brain health. How many of us in the room have ever wondered about our own brain health or the brain health of a loved one in our lives? Right, I'm seeing almost every hand go up, right? And really of every age in the room too. So this is a major topic that impacts all of our lives. I just learned that 1 in 3 people worldwide suffer from a neurological disorder. That's billions of people. It's the leading cause of illness and disability worldwide. So I'm so glad we're able to talk about it. We're going to learn a little bit about what is brain health, how do you keep your brain healthy, how do you support yourself and loved ones who might need some support as our brain health might decline. So with that, I'm going to introduce a couple panelists. So we have Katie Zeitler here. She is the program manager for Dementia Friends Washington. That's housed at the UW Memory and Brain Health Center, Brain Wellness Center. Katie has been working with people with dementia and their caregivers for over 20 years now. No, 10 years, 2013. My math is shaky. So for 10 years, Katie's been doing this work in a variety of settings. She's worked in nonprofits, she's worked in patient care directly, and she's worked in public health. So she's got a big breadth of experience to draw from. I'll let her tell us a little bit more about what Dementia Friends Washington is, and learn more about that. And Dr. Karen Torres is also here from University of Washington Department of Neurology. She is a board-certified clinical neuropsychologist, right? It's a mouthful. And has also a real wealth of experience when it comes to brain health from kind of a clinical perspective, so she can really tell us what's happening in our brains. She works primarily, or at least significantly, with Spanish-speaking populations and does a lot of screening and evaluations with Spanish-speaking community for many, many years. And she's worked not just here in Seattle, but in many other cities around the country, Los Angeles, Detroit, Boston, and I'm going to guess that brain health rises to the top of issues people are dealing with in all cities, right? So with that, I'm going to kind of kick us off, and I'll moderate today's panel, but I by no means need to be the only person asking questions. So if you have a question, we want this to be a discussion. Feel free to raise your hand. You can stop us mid-conversation. We really welcome participation, or if you don't understand something that one of the panelists has said, or you want to know more, jump in and ask those questions too. So that, I think we'll just share this microphone until we get the next one. So I'm going to start with both of you and ask you, what is brain health? It's kind of like a big umbrella. So what are we talking about when we talk about brain health? And then Karen, specifically, what does a neuropsychologist do?
All right, so when I think of brain health, I first think of our brains and everything our brains are responsible for. So that could be everything from our memories to our personalities, language, our physical movements, breathing, all of our senses, and so much more. So when I think of the words brain health together, I think of how do we keep all of those different areas in our brains healthy, so that they can continue to function to the best of their abilities. So for me, brain health is learning about ways to keep our brains healthy.
So I'll start with the neuropsychologist piece. So as a neuropsychologist, my focus is in evaluating cognitive function and emotional functioning in people who are not only aging, but who are reporting changes in their abilities, like their memory. So my role as a neuropsychologist is to do an interview to get a sense of how maybe these changes in thinking are affecting your life or presenting changes in your life. And then there is testing that happens, memory testing, attention testing. And we do this testing to see the integrity and the health of your brain. Because different parts of your brain are responsible for different abilities. One part is responsible for memory. And so through our testing, we evaluate how strong your learning and your memory still is. And that gives us a good clue of how healthy your brain is. So it depends on, the reason that I am seeing individuals, what sorts of concerns they have. We do the testing, we get a profile of their brain, see what areas are strong, what areas are weakness. That may help us come up with a diagnosis, for example, if these changes are part of normal aging, or are they related to something like dementia, related to Alzheimer's disease, or dementia related to a stroke someone may have had previously. So we come up with possibly a diagnosis and then recommendations. Recommendations that are driven by this notion of, okay, there is a problem, but there's still something the individual and families can do to help keep this individual as healthy as long as possible. So when I think about brain health, I think about the integrity of the brain and how it affects different abilities.
Okay. Yes, please.
So, based on your introduction, what I was hearing is when you get to the point where you have to do a diagnosis, I'd be curious when you talk about brain health, what are some of the preventative things, or what are the things that you can do to help ward off dementia as long as possible? That's why I'm here, because I'm at the stage now where my mind is still intact. I have a pretty good memory still, and I still pretty active. I still read and do all those kinds of things. But what is it that we need to do as an aging person to do preventative care as well?
Great. And okay, so yes, thank you for the question, and we definitely want to cover that. And then behind you, there's also a question. So
you're probably going to cover this too, but can you tell us the difference between dementia and Alzheimer's?
yes. Okay, so to repeat the question, she would like to know the definition or the difference between dementia and Alzheimer's. And I saw you raised a hand also.
Well, I was trying to hear her.
Oh, okay.
Thank you for repeating the question.
No problem. So let's just jump in there. Let's maybe start with the difference of dementia and Alzheimer's. We can get a little point of clarification. And then we can jump right into what are some tips to keep our brains healthy. And then I want to come back to some of the diagnostics testings and some of the questions that I have as you were speaking as well.
So the difference between dementia and Alzheimer's disease. Dementia is an umbrella term. That means that you're having cognitive changes like memory difficulties that is interfering with your everyday activities. So for example, due to the memory difficulties, you can't manage your medication on your own. You can't drive anymore, or you're forgetting about your finances. So when your cognitive difficulties begin to impact your independent living, you may be diagnosed with dementia. But dementia is caused by different diseases. So Alzheimer's disease is one cause of dementia. And Alzheimer's disease essentially is an accumulation of different proteins in your brain that clump together and start harming your brain, the healthy tissue of your brain. And primarily with Alzheimer's, the first sign is memory loss. And I know it's scary because a lot of us experience memory loss, but this is why an evaluation is necessary. So Alzheimer's is one cause of dementia. For example, other people may have a lot of vascular diseases, like for example, a stroke. And a stroke that affects the part of the brain significantly can cause cognitive changes and subsequently be diagnosed with dementia due to vascular disease. Any other questions about that?
I think this might be a good chance to kind of follow up on that before we talk into ways to keep yourself healthy. I would love for Katie to tell us a little bit what are some of the risk factors that we might already have, just so we kind of know our risk level. And then, yes, did you have a
Well, I
question?
did want to ask some questions. I was just wondering, in this way of dealing with overall well-being, mentally, physically, emotionally, and so forth, I know in non-Western traditions of health, healing, and wellness, and that honors our psychological nature as well, or transpersonal psychology, or the different forms of psychotherapies, which also approach the realm of what you call another aspect of our being that's beyond our mind, but how we deal with life and challenges creates different kinds of traumas, you might say, that charges the way our energy flows. So there's things from traditional Oriental medicine, as well as East Indian medicine, the Ayurvedic, and all those other ways that honor our whole being, not just our physical being. And so do you have any kind of similar ways of adding the input of that kind of knowledge that has, because there's been a lot of research done by different scientists from different parts of Asia who understand that, plus even in traditional things that happen in the Middle Eastern world, in the African countries, you know, they have their own form of, let's say, folk medicine,
Let me try
folk
to.
healing. So I was wondering,
Yeah, if it's okay, I'm gonna try to repeat your question so everyone can hear. And I think maybe Katie and Dr. Torres can touch on this. In non-Western cultures, there may be other approaches to holistic wellness. And what do we know about that and the impact of those approaches on brain health? I think, is that a fair statement of your question?
Yeah. Are there any aspects of how you have your clinical research that somehow will honor some of the
Right.
input of that understanding of how the mind, body, and spirit works together?
Okay.
You know.
So I'll turn it over to the panelists to dig into that, and maybe again we can kind of, and maybe this is connected, touch on some of the risk factors that folks should be aware of, and then any kind of cultural relevant context that you want to offer.
I think that's a really great question, and I think that I'll share some of the risk factors. I do think with some of the East Asian medicine, there's a holistic approach to everything. So when we're looking at risk factors, we are very much taking into account everything going on in the person, outside of the person, and it's more than just taking a pharmaceutical medication. I know it's very much about your social group and how you're socializing with others, and exercise and movement. So just to kind of get started, so they kind of categorize some of these risk factors into two sections. So we have non-modifiable risk factors, which would include things like your genetics, the sex that you're born, maybe your race and ethnicity. Those are things that you cannot change. And that can impact your risk of getting Alzheimer's or another type of dementia. Then there's a list of modifiable risk factors. And those would include things like, maintaining your hearing. So it's really important to maintain your hearing. There is a lot of research around this, which I'm not the most expert person to go into to talk about, but good to get your hearing checked, wear hearing aids if you need it. Managing all of your blood levels, so your blood pressure, blood sugars, cholesterol, keeping those all in the range that they're supposed to be in. Lowering your alcohol consumption, so excessive alcohol consumption is not good for your brain. Obesity, so managing weight. Smoking, not smoking anymore, managing stress. If you do have depression, which is more than just being sad, it's important to check in with a doctor to have the depression treated. Other things, social isolation. Social isolation can lead to a lot of other health issues. It's really, really important to remain as social as possible. And it's not always the most comfortable thing to have to go out and socialize with people. I know that I am a very introverted person, so it's not my favorite thing to do, but I do recognize that it is important for my brain health and my overall health. There was a study that came out recently about the effects of pollution on dementia, or causing dementia being one of the risk factors. So if you are in an area where there is high pollution, if there's a lot of wildfire smoke, there can be things that you can do like wearing an N95 mask or having an air purifier in your home. And then managing any head injuries. So if you like to go out and ride a bike or maybe motorcycle sports, football, any opportunity where you might injure your head, just making sure that you're preventing that as much as you're able. And then also if you're on any medication after, let's say, a surgery that could make you higher risk for a fall, just making sure you have somebody with you, that you've got everything well lit, that you have a clear path to walk through or move through. And those are all risk factors that we can kind of modify and manage. So I know that's not really speaking to all of your question, but it is kind of a holistic approach with the environmental and lifestyle piece in combination with the genetic piece. Do you want to say anything else? No. Okay.
So let's before we I'm debating which direction to go here. Before I forget, Dr. Torres, I wanted you to share a little bit more about what kinds of testing is involved in diagnosing potential brain health or cognitive decline, and how someone would go about getting that test, and if I can tack on again, how someone might encourage a loved one to go get that test and when it might be time.
So there's no one test that will diagnose dementia. So in an ideal world, you'll share with your primary care provider or nurse practitioner that I may be struggling with memory. And they will say, okay, let's rule out any reversible causes of cognitive or memory difficulties, which includes a malfunctioning thyroid, for example, vitamin B12 deficiency. So one of the first things, hopefully, is you'll get blood testing to see if there's any abnormalities in these areas. If there is, then you'll treat them and see if memory improves. The next test will be, okay, maybe they'll send you for an MRI of the brain to look at the structure of your brain, to see if those areas that should still be nice and plump are still nice and plump and robust, or is there shrinkage in specific parts of the brain that are in charge for memory, for example? And I'm just using memory because that's one of the more common changes that people experience. So you have blood tests, you have an MRI of the brain, and then they may recommend you come see me in neuropsychology to get an assessment of the function of the brain. So that MRI looks at the structure. The neuropsychological testing will help understand how well the brain is functioning. So the testing is, I'm not gonna lie, it feels like school, because you're given a lot of paper and pencil testing, looking at different parts of verbal memory, visual memory. We want to see how quickly you can perform tasks, how you problem solve. We're looking at all parts of your brain, not just memory. And your scores on these tests are compared to other people of your age group and educational level to see if your scores are comparable to your peers. Okay, your scores are not going to be compared to 25-year-olds, 25-year-old memory, because that's unfair. We compare them to your peer group to see if it's well within expectation of someone of your age group or if it's below, okay? And if it is below, okay. So we have the information from the MRI, we have information from blood tests, and now we have the neuropsychological data. That can help us come to a conclusion about diagnosis and recommendations. And the second part is, if someone in your family is struggling, how can you get them to?
Yeah, and maybe even to back up and ask you, when is it the time to tell your primary care doctor, hey, I think I might be struggling with memory or brain health, and what signs should someone look for?
Absolutely. So changes can be tricky, okay? Because as we all get older, every single one of us, our brain will change, and how much we're able to remember will change, okay? It's when, for example, we're cooking and we're not turning off the stove. Not only one time, because that could happen to any of us, but it's repeatedly happening. Or we're going to our pill box and noticing that more often the pills are still in there. We're not taking them as we should. So it's when these memory changes begin affecting your life. And typically, it's hard for the individual to notice that first, and it may be a friend or a family member who lives with the individual who starts noticing first. And when that happens, one way to approach maybe getting an evaluation is not asking the big question of, Mom, do you think you have memory loss? That's never helpful. Mom, I'm noticing that, I'm noticing that a lot of the pills are still in the box. What's going on? And it may be as simple as, oh, my alarm isn't going off anymore. Let's figure that out. Or it could be, Mom, do you feel safe to still drive? Are you getting lost while you're out there on the road? Asking those questions. Because asking them in a small way with examples can lead or breed more trust in those types of questions, because being asked, is your memory changing, or do you think you're having a lot of difficulties, is a big question. And it may be hard for some people to recognize it in themselves or to acknowledge how troublesome it is. So I'm always the approach of starting small, seeing if it continues, because that's the important thing, that there has to be a pattern or consistency in these difficulties. Because that's the question that a primary care will ask you, well, how long has it been going on? Are there good days or bad days? So really trying to introduce this topic in a very tactful and small ways, so that we get to the big question, and it's easier to feel more comfortable in talking to a primary care about it.
Thank you. Okay, so now to kind of turn towards, well, now we know when it's time to seek some clinical help, maybe when it's time for an evaluation, how to ask for an evaluation. But what do we do in the meantime? How do we keep our brains healthy as possible for as long as possible? So Katie, you mentioned a few things. Some of the things that stuck with me are making sure we're socially connected, addressing hearing loss, which is huge. I think there's more and more data out there linking hearing loss with dementia. But what are some other factors or other ways that we can keep our brains healthy? How important are things like nutrition, sleep, physical activity?
Did you want Katie to?
Let's start with Katie, and then Dr. Torres, feel free to jump in.
All right, so nutrition is very important, of course, and within those modifiable risk factors, there are things like keeping your blood pressure low, your blood sugars low, your cholesterol low, so that will come from mostly from diet, and it's important to eat well, and to have, there's different research on diets out there, and it's always important to check in with your doctor and a dietitian also to make sure that those diets are appropriate for you. But yeah, by kind of keeping all of our blood pressure, blood sugar, cholesterol within range, that is one way to really support keeping our brains healthy. As far as sleep goes, it's so important to get sleep every night. That's an opportunity for our brain to rest and repair itself. So it's suggested that you get 6 to 8 hours of sleep a night. I have a hard time with that. My husband has sleep apnea. He is up and down all night snoring, so sometimes it's not the easiest thing to do, but it is important to get some good rest. And let's see, nutrition, sleep, physical activity, thank you. And physical activity, it's really important to get up and move your body around. It's whatever that looks like for you, whatever's within your abilities. It's important to move. There is a percentage of risk reduction that can happen with physical movement. So whether that be, running, walking, doing Tai Chi, gardening, it's all important and it all has an impact on your brain health.
One follow-up question, whether Katie, you want to take it or Dr. Torres, is it, if I'm a person and I'm 75 years old and I haven't really done much physical activity in my life, I've had a pretty poor diet, is it worth it to change, I guess is my question, and how much control do I have at that point?
So one important concept to discuss related to that is that of brain plasticity. So has anyone heard of that before? So it's this idea that your brain keeps changing and is capable of adapting even though we're aging. So that means that the exercise you start doing now, for example, or other activity that you start doing now can help your brain in the long term, because exercise affects your heart health. Okay? So with exercise, you reduce your blood pressure, your cholesterol may get better, diabetes gets better. But anything that affects your heart also affects your brain, because the brain needs oxygen and exercise gives it oxygen. So absolutely, starting now can help tremendously.
And again, folks in the room, if you've got more questions. Oh, yes.
Okay, you did mention physical activity, which I agreed with. What about mental activity or mental stimulation? Does that play a role?
Yeah, so let me just repeat for everyone. In addition to physical activity and getting that heart pumping, that oxygen to the brain, what about mental activities?
Whether it's word puzzles,
Right.
learning an instrument.
Right.
So mental activity, and maybe you can provide examples, but we just heard learning an instrument, word puzzles, there's all kinds of games that are touted as, keep your brain healthy. Do those work? Should we be doing those things?
The ukulele.
Yes.
Sorry, what was that? Oh, yes, absolutely. So,
I was gonna say, could you also speak to becoming addicted to those games?
Yeah, super interesting. Can you also speak to becoming addicted to those games? So at what point does Candy Crush stop being healthy and it takes you down the backside?
when you're playing too much Candy Crush and you're not attending to your other affairs, relationships included with friends and family. When we're talking about cognitive abilities and activities to keep your brain healthy, I'm going to step back and mention first activity has been proven to keep brains healthy. And that includes physical activity, which we've already touched upon, cognitive activity, which I'll talk about right now, and then social activity. those 3 types of activity have been proven to be good markers of healthy brain aging. So when, I get this question all the time. So doctor, so you tell me that my brain is fine for my age. How can I keep it there? And I mention activity and cognitive activity specifically. It's great if you play bingo, if you do crossword puzzles, wonderful. But the true key is in new learning. So challenging your brain with a new activity. So yes, playing an instrument is great, a good indicator of trying something new. But I need to say this as well. It has to be something new that you're interested in. So don't start playing guitar if you've never liked it. You're not gonna do it, right? It needs to be something that you're interested in doing. Maybe I was never interested in doing gardening, but I'm looking at all the roses now. Let's give it a try. Start with a small plant. That's something new and something that's interesting. And it also has to be challenging. Okay? So if you do want to learn an instrument or a new language, for example, think about it as you don't have to become a master at it. Because the simple act of learning something new is enough for your brain to make those connections and support this theory of plasticity. Plasticity is driven by new learning. So as long as it's interesting to you, new and challenging, you'd be well on your way for good cognitive activity in your daily life.
That's super helpful context to have. I want to run a theory by you related to playing games on your phone or computer. I heard someone say that it's not the playing of the game or doing of the puzzle that's necessarily the helpful component, but it's the learning how. Maybe you're challenged, speaking for myself, it is not always easy for me to figure out how to download something, how to play it, where the buttons are, and just the simple act of figuring that out can actually be helpful. Not just the kind of like mindless scrolling and playing, but the figuring it out part. Is that right?
Absolutely. That's the new learning aspect of it, is you're taking your brain to think about something completely new. And it's in that problem solving and building that learning practice and memory that is the key. Not whether or not you become great at Candy Crush. I mean, that'd be a plus. But it's the learning aspect of it that is the important thing.
I don't think I have anything else to add to that. I thought that was great. Thank you.
Well, Katie, because of your work with Dementia Friends, and maybe you can also tell us a little bit about what is Dementia Friends. What are some ways that folks can support friends and family in keeping brains healthy?
That's such a wonderful question. Thank you for asking that. So the Dementia Friends program, we basically go out into our communities and share information with community members just about dementia, what it is. We talk about some brain health, and then we encourage everybody to choose an action item to make our communities more dementia friendly. So a dementia friendly community is basically a space that is inclusive, supportive, understanding and caring of people who are living with dementia and their caregivers and care partners. So we talked about the activities being very important for the brain, so physical activity, mental activity, social activity. A lot of dementia-friendly events that are offered kind of speak to one of those types of activities or maybe more than one. So I know there's quite a few dementia-friendly activities that happen here at the Southeast Seattle Senior Center. But I'll just share a couple of examples. So we have what's called a memory cafe. And a memory cafe is a wonderful opportunity for people who are living with dementia and their caregivers or care partners to come and have social time, not really talk about dementia, maybe listen to music or do art together, and have some refreshments. So it's a time to socially engage and get to talk to one another. Another example of a dementia-friendly event, we do nature walks. And that's a great example of going out and having some physical activity. Moving around with people you know, there's also a social element to it. So there's different ways to kind of get connected into the dementia-friendly events within our community, but I do think they're a wonderful place to start for anybody who has dementia. There's for people who have an early onset Alzheimer's diagnosis, there's a hiking group. So there's all sorts of things that are happening, and we're starting to see more and more of these types of events. So there is a lot of growing support in the communities.
And how would someone find out about those events, and are they free?
Great question. So they are free. On the back table, there is a red and orange card called Momentia. And she's holding it up back there. You're welcome to take one of those. So there's a website, and there's a list of all of the dementia-friendly events happening in the area. So that's one way to find out about them. The person who maintains that website keeps it very up to date. So it's a great resource. I do know that there are some events happening here at this center, so you could always check in with the calendar here and see what's going on. And then we're part of the Memory and Brain Wellness Center. One of the prongs, if you will, of the Memory and Brain Wellness Center is something called the Memory Hub. It's a community center for people living with dementia and their loved ones who are helping to care for them, support them. And we have a bunch of different dementia-friendly events happening there, as well as education, support groups, and more. So a couple of different ways to get connected into everything.
Yeah, another question.
Not so much question. Like over here, there's a nice bulletin board
Oh,
that has all kinds of stuff being offered there for people. Connect with all kinds of activities that's not even in our newsletter, you know.
That's so great. So there's a bulletin board. Where is it? It's back here?
Yeah, right there. There's a whole list of stuff.
Oh,
Flyers and brochures and things like that.
okay, great.
And also the like, I know at some grocery stores, like PCC, those beautiful bulletin boards that have all kinds of activities for all ages and for all kinds of people who want to do different things for the mind, body, and spirit. You know, and that affects the mind.
Yeah,
Yeah.
there's lots of resources in the community. I'll also do a plug the Seattle Parks and Rec Department.
Oh, yeah.
They've got a lot of great events, including summer dance lessons in various parks around the city. So I mean, that combines the social activity, the physical, and I mean, for me at least, would be learning something new. So there's a lot of opportunities to kind of plug in and do that learning and socializing that we talked about. I want to ask, we've talked a little bit, Katie, you mentioned kind of creating a community that's a little more dementia friendly. And I'm curious to know what role stigma plays in dementia and brain health. And specifically, does it lead to later diagnoses, delayed care, folks not being able to get the resources that they might want to get? And what are some tools that you might suggest, ways to combat that?
That's a wonderful question. So with stigma, so dementia is a very stigmatized word. It is something that people are fearful of, they're anxious about, they're scared of. Maybe they've had a loved one who has had a diagnosis and they've seen them go through the process. So it is something that is not the most comfortable thing to talk about. And because it's something that we kind of maybe shy away from a little bit, and I think everyone's getting better with talking about it, but because it's still something that's not the most comfortable thing and not the most openly talked about thing, it does make it where people don't want to share that they have a diagnosis. They don't want to ask for help. Maybe they delay going to a doctor because they don't want to talk to their doctor about it. There's all sorts of things that people might be feeling around this, and there can be an overwhelmingly negative feeling about the word dementia, so that can lead to that stigma. It also may keep people home. It may keep people from socializing. Maybe they don't want to go out and socialize with a group because they lose their train of thought mid-conversation, or they can't remember the person's name, or some other reason, conversationally speaking, where they're kind of pulling away a little bit from having that social interaction. So I think stigma really creates a lot of more negative experiences. So with the Dementia Friends program, we are trying to share this information about dementia to hopefully destigmatize it, to make people feel more comfortable around the word dementia and around people who are living with dementia. And when that can happen, then we can bring people out, hopefully, to be more social and participate and be a part of our communities and a part of our spaces. And there's different ways that we can make different spaces dementia friendly. So for example, if any of you attend a faith community, maybe there could be a shorter sermon option. So for somebody with memory loss, an hour might be a really long time for them to sit through something. So maybe reducing the time of the sermon could be a way to include them still. And then, I'm so sorry, what was the other part of the question?
Let's see, what was the other part of the question? I was just paying attention. I know
Sorry, that's interesting.
What role does stigma play, and what are some of the ways that we can kind of combat that stigma?
Okay, yeah, I think education is really important. The more we understand about it, the more, destigmatized it'll be, the more comfortable we'll be with it. It is a hard thing. It is a hard thing. I just want to validate that. This is not an easy diagnosis, but it is so helpful to be able to still have people be active in different ways and to support them. So I do think that as long as we can, have more education, there's support group options. So if you're caring for someone who has dementia, if you've been newly diagnosed, if you have mild cognitive impairments, there's different options to seek support. And I feel like being able to go out and have those supportive options can kind of also help reduce that stigma, because there are other people that you can connect with who are going through something similar. Do you have anything you want to add? Okay, great.
So is cognitive decline, is memory loss just a normal part of aging? Karen, maybe you can walk us through what's happening in our brains as we age, what's normal versus not.
So all of our brains start shrinking as we get older. And not that shrinkage is a bad thing, because it happens to all of us. It's just a matter of how much is it shrinking. Okay? So like I mentioned earlier, if you come in for an assessment and I say, you're doing great, as good as your peers, the memory loss that you're experiencing in everyday life, like walking into a room and not remembering the reason you went in there, or misplacing your eyeglasses, word finding, coming up with a darn word, could be part of normal aging. It's when on testing we have evidence that there are more significant difficulties, that it's not related to normal aging. So I just want to reiterate that all of our brains change with age. It's just a matter of how much it changes. So, I have word finding difficulties. I'll walk into a room one day and say, shoot, what was the reason for doing this? I never did that before. It's hopefully part of normal aging.
So we have about 10 minutes left, so I want to make sure that if folks have questions, we do get those answered. Yes?
I have a weird question.
Perfect. Love a weird question.
That's weird. All right, I'll take the weird question.
I want to be proactive. All this information is very great. But I want to be proactive. I want to ask. You're talking about all this testing. I don't want somebody to point me out and say I need to be tested. I want to be proactive. If there are programs that you have going on at the University of Washington now that'll take me as a guinea pig and test me in all those areas, and be honest, they come back to me and discuss it with me. So I don't want somebody to tell me, well, you done lost your mind or playing with my mind. I want to know why I have a little wisdom.
You want evidence.
Right!
So I do have a sheet for all of you in the back. There's a resources there. So I'm part of the Memory Brain Wellness Center over at Harborview. So it is a clinic that focuses on memory disorders or memory changes. So they have an interdisciplinary team of neurologists, neuropsychologists, nurse practitioners, social workers, all who specialize in assessing for dementia or other cognitive changes. So that would be a great clinic to visit if you have strong concerns about how well your brain is doing.
I just wanna know.
Yes, absolutely.
I wanna be proactive.
Absolutely, because we have talked a lot about what you can do, right, to be active and keep your brain as healthy as possible. But you're doing it now. By coming to this chat, you've been physically active because you had to get here. You've been socially active because you're interacting with one another, and you're learning something new, hopefully. So just being here today is brain health, and you're thinking about your cognitive fitness. So
Right, also, when I leave here in the other days, I'm going out there and there's other people that may have some signs of this. I wanna know how to get along, communicate, and make them feel comfortable. You know,
maybe that could be a
What
part
they-
two.
what they, you know, I don't wanna diagnose them, but I wanna be able to make them feel comfortable before somebody say something is loose or the marbles is rolling or something. You get what, do you understand what I'm coming from?
Absolutely.
Yeah, I want to follow up on that question, and then did you also, I saw your hand up briefly?
I just wanted to say a funny story. I signed up for a study on aging with Kaiser, and I flunked. I said,
What do you mean you flunked?
I said, when you answered all the questions and your memory is too sharp for this program.
You were rejected. Flunked in a good way, yeah. Okay, so a couple of things I just wanted to lift up. One, we are in this like research-rich environment here in Seattle, right? We have a lot of institutions here, including University of Washington, which does really amazing work around brain health research. So Dr. Torres mentioned that you can participate in studies. There's lots of studies happening all along. I mean, you can try, maybe you'll get rejected, but not a bad idea if you're curious and you want to be plugged into the world of research. I know I just had a baby and I checked the box for would you participate in infant studies, and I've already got a call from UW. So it feels cool to be part of contributing to the body of knowledge that's out there. So that's one reason you might want to participate in research. I also want to remind folks that the process for being proactive and getting an assessment done is just tell your primary care provider. You don't need to necessarily, I'm assuming, you might correct me, but you don't need to have a whole list of reasons why. They'll probably ask you several follow-up questions, but if you just start the conversation with your doctor and say, hey, I'm aging, I'm concerned about my brain, I want it to stay healthy, what's the next step, can I get an assessment? That's how to start that dialogue. And then they'll kind of loop you into the next steps from there. And then to lift up your question around how do we support people in our lives or the community who might be experiencing dementia, I want to turn it back to our panelists. You mentioned just people in the community. So sometimes it might be a loved one, maybe it's a parent, maybe it's a spouse, maybe it's a sibling, someone really close to us, and we might be the caregiver. We might be the person hooking that person up with resources, attending the support groups. But sometimes we're just a person in the community walking around and we interact with someone who may be experiencing dementia. How do we, as good community members, support that person in that moment? So can I ask our panelists, kind of what are some tips for supporting folks in our world with dementia?
So the first things that are coming to mind for me, and I also just want to say dementia is going to look a little different for everyone. It's very unique to each person. But I think the way that we communicate with somebody who has dementia is really important and crucial. So we always want to treat people with dignity and respect, of course. if there is a, you know, a question of if this person has some sort of cognitive impairment or dementia, I think it's great to keep in mind that their processing time might be a little slower than ours. So I know that if you, let's say you ask them a question and they don't give a response right away, you might want to wait a little bit to see, you know, if the response comes out before maybe jumping to re-asking the question again, or assuming that maybe they didn't hear you. It's possible they didn't hear you, but I think just, you know, making some space and holding space for processing time is important with that communication. At our Dementia Front sessions, we kind of go through a ton of different communication tips, so I'm trying to pull out some of the most helpful ones right now. I think, you know, asking very short, simple questions, maybe with a yes or no answer, can be really helpful. I'm trying to think of what else could be really useful right now. I think that if somebody's having a hard time recalling your name, and you know that it's embarrassing for them, it can be really helpful to come in and say, "Hi Mom, it's me, Katie. I'm so happy to see you today." My mom might look at me like, "You're my daughter, I know your name is Katie," but if I knew she was having difficulty remembering my name, then that would be saving her some embarrassment. So that could be a way to be supportive. I also think that checking in with them, just socializing with them, maybe a phone call, maybe a visit, that means so much to people. So those are a couple of ideas.
Well, I mean, I think those are all wonderful.
So we're coming up on time. Oh, dance. Okay. So
I was going to ask Dr. Torres personally, but it's in a similar frame of mind. I have a friend that I tell here every Monday. I have a wonderful friend who she's a special ed teacher, a doula, so you know what her personality is like. And she's also, during her life, suffered with depression. And now she has been diagnosed with dementia. And I try to do all those things you just mentioned with her, just simply because she's such a great person, but try to keep her dignity and be respectful of her. So I wanted to ask you a couple of things. First, I need an alternative in responding to her, other than saying, "Girl, you remember when?" or "Remember this?" What can I say? And she'll say, "Well," I'll say something like, "Well, remember last week I said something that I don't know." Then I try to change it up, but I really just need some verbiage to sort of not say, "Remember this?" And then the second thing is that because she does suffer with depression also, will be here, and she used to love to dance, well, she can't always remember the step, and I say, "You know, we're gonna come and we're gonna exercise and we're getting out of the house and we're not gonna be about production, we're just gonna dance," you know, try to encourage her to do that. But sometimes she gets really weepy and just says, "You know, I used to dance and I can't do this," and she'll stop and she'll get really weepy. What's the best thing to, I'm trying to close her up, but what's the best way, or what would you suggest in how to respond to when she's weepy, or just let her be and just hold her?
I think both of those options are really good ones, because people need to be heard and they respond in different ways. So for some people, crying helps. You know, feeling sorry for what you're going through for 5 minutes can be very helpful, but it's important to move on as well. So affirming her attempts at dancing, for example. You know, Deborah, you're doing a wonderful job with this dancing. Let's keep doing it. You know, I'm gonna be here next week and we're gonna keep trying this. And when it comes to the question of, do you remember? I know for a lot of people it can be triggering, right? Do you remember this? Do you remember that? No, but if you wanna visit something that you did talk about the week before, say, last week we talked about going to Debbie's house. Sometimes that clue itself can help retrieve that memory itself versus starting off with a question.
You know, we've been friends for 50 years.
Yeah. And
I should break that.
And showing pictures of things you've done together can be also helpful. And if you really want to talk about that event that happened 10 years ago, or that wedding you attended. Yeah, it's typically the short-term memory that is the most difficult. But again, framing it with, last week when I was here, we talked about this and seeing where that leads.
Before I wrap us up, I want to make a quick plug for one thing you could try, and you'll tell me if this is actually connected, but I have been learning more about ageism and the impact of ageism on all of us, and the ways that ageism prevents us from caring for ourselves and kind of believing that we're worth the investment as we age. So my team created an anti-ageism training that is intended for all people, and what we're finding is that it's a great chance to kind of reflect on how you might be viewing yourself and viewing the investment in your own health and life. And I would encourage folks to check it out. We'd love to know what you think, but it's one tool out there to get you to reflect, and really all of us of any age, reflect on how ageism impacts us. Katie talked about hearing loss, and ageism can really prevent someone from being willing to wear their hearing aids, right? And that's a big driver of dementia. So there's a connection there, and I invite folks to take advantage of it. We'll do one more question, then I'm going to ask for our panelists for their final favorite brain tips. Yes.
Hi, I'm Candace. I'm a UW Jerry Fellow. So thank you for letting me participate. I just wanted to point out two things as I'm hearing about all the questions and things that you guys were talking about. Going back to the depression can actually act as making us look like we have cognitive problems. So we call that pseudo dementia. So, hi, I'm Candace. I'm a jury fellow, so I'm family med trained. I'm doing more training as a geriatrician. So, going back to the question about depression. So even with younger population, like, whether it's a teenager or, younger people, actually if they have really debilitated depression, it can look like they have dementia. It can make them become very forgetful, not wanting to participate in activities, not able to remember things, or they have word-finding difficulties. So it is important to treat the depression, to rule that out as part of what's causing the memory issue. Do not just think that, I would say dementia, that's why it's important to kind of go to your doctor, get a full evaluation, because when we look at everything, we do all the labs, we do all the history taking, we take a look, are you sleeping okay? Is your eyesight okay? Are you eating okay? Is your nutrition okay? Is your hearing okay? How is your social dynamic? Everything else, and then your past medical history, your family history, and everything, right? And then in terms of mood is very, very important, because if you have depression, you have anxiety, you have PTSD, if you have any psychotic, episodes or whatever, that can really make you have difficulty with thinking and, processing information. And people may think that you have dementia, but that is not what it is. If you treat the depression, if you treat your mood disorder, you can actually still function very well. And so it's important. Sometimes we treat it with therapy, but a lot of times we treat it with medication. And so the best study have found therapy with medication that works the best. And then going back to your question in regards to if you see somebody in the community and then they look like maybe they're missing something, maybe they are having some difficulty functioning, I would just say we want to be careful. On my first visit with any patient, or even second visit, I never diagnose anybody with depression. I put it in my note and say, this is something I want to kind of check into, because I don't know this person as a whole person, who they are. Maybe they just speak differently, maybe they, behave differently, or they, process information differently, or slower, or they have a cultural difference than us, then, so I don't wanna, name them something, immediately. I wanna make sure that I have a good understanding of who they are, where they're coming from, before I start making a diagnosis, or even thinking about that. Or maybe they're having, infection or something, right? Because when we have infection, as our brain age, our brain become more vulnerable. So maybe we have an infection, maybe we're having some social stress, then that can make our cognition also become less functional.
Thank you for adding that. I know that folks are eager to get to lunch, so I do want to wrap us up and just ask our panelists, quickly, what's your favorite brain tip?
Okay. My favorite brain tip, being physically active. I go out hiking often. I'm out almost every single morning. I wake up way too early. And I like to go for either a walk outside around the park by my house, or I go for a really short hike and just get some fresh air, hear the sounds of nature.
And my brain tip is, we've talked a lot about what you can do today. A lot of activities, social, cognitive, physical activity. My tip is, look at a calendar and slowly add different things you can do throughout the week. Don't say, oh, I'm gonna have to go to the gym 5 days a week. No. Monday, 30 minutes of exercise. Tuesday, I'm gonna go to Debbie's house. She's gonna cook dinner, so I'm gonna leave my house and go there. Wednesday, I'm gonna look at a new puzzle and see, by putting it on the calendar, even though one thing at a time, it keeps you accountable. And it makes the process of you actually doing these things much more realistic. So start small, that's the key.
Thank you both so much for being here, and thank all of you for your participation as well. Hopefully you learned something. We have resources in the back if folks want to check those out. I think our panelists, I'm going to speak for you, would be happy to stick around a few minutes if folks have questions you want to ask privately or directly. But really, thank you for sharing your knowledge and expertise with us today. We really appreciate it.